Hi, I'm Dr. Adam Crane. I'm the clinical psychologist with the Kane Center, and this is the Behavioral Change Series. In today's topic, we're going to be discussing stress management as part of our ongoing series on behavioral change and understanding the psychological side of weight loss surgery. So with today's talk, aside from just understanding how to manage stress better, which is a pretty common concept and a pretty common experience that most people have in their lives, through bariatric surgery, there's a very particular way to look at stress and understand how it might impact your weight loss. So there are some very specific discussion goals that we're going to try to cover. And in particular, we're going to define stress and how to better recognize it. We're going to try to understand what kinds of stressors arise throughout the bariatric process. Third goal is to appreciate how stress might impact your weight loss and your adjustment to the bariatric process and bariatric lifestyle. We're also going to want to come up with some strategies just meant to improve your stress management, and just if you are a stress eater, use food for any emotional reasons that you find ways to be able to reduce that and find alternate ways of coping. So to really start off, it's probably helpful to have a working definition of what stress is. I think most people have some experience in what stress is, and probably everybody has maybe a very different definition of how they experience stress. But to understand it from a working definition will probably be helpful in going forward with seeing how it applies to weight loss surgery. So the way that stress can be defined, it can be seen as an uncomfortable gap between where your life is and where you would actually like your life to be. So if you have some unrealistic or some lofty expectations, you may be feeling more stressed than someone else who has more of a realistic appraisal of what their tools are, what their time frame might be. You know, the larger our expectations are, we may feel more challenged and have more of a difficult time feeling that we can actually meet those expectations. We might feel unprepared to manage our daily events just because we may not have necessary tools. So part of the goal in reducing stress is obviously to develop those tools, which is part of what these talks are about. Stress can typically manifest as feeling overwhelmed and just unable to cope with emotional or mental pressures. Obviously, it can have some psychological or some physical consequences depending on the person. And also, stress can occur from a number of different sources: cognitive sources, behavioral sources, physiological sources or influences. And for bariatric purposes, you might experience a number of these different kinds of categories, and it's important to understand how they have impact on the bariatric surgery, your eating habits, and so forth. So in general, how do we recognize stress? And like I was saying just a moment ago, that stress is a pretty common experience for most people, but we all have different ways of seeing it. So there's been studies done, and it's shown that roughly 59% of adults report feeling high levels of perceived stress. Some of the physical identifiers that people kind of most commonly report might include aches and pains, changes in sleep patterns, changes in appetite. You might have greater susceptibility to colds and illnesses. You also might have some cognitive identifiers, some things that just part of your thought process, these including just feelings of indecisiveness, poor focus. You might be more distractible than you normally would be. You might be more irritable and have some mood swings, going from anywhere from some severe anxiety or some depression. So there may be some inconsistency in just how your general emotional presentation is. You also might find that you have mental fatigue, that you might burn out faster than you normally would, that you might get overloaded quickly, more easily overwhelmed. And sometimes your thinking might have a way of, in effect, shutting down or being limited in how you can approach your problems, which could contribute to you feeling unable to solve problems, confused about what's the best way to go about solving a problem, and just leave you relatively immobilized. And also, stress can be caused by a number of triggers. We experience stress from all sorts of different sources. And some of the more common ones are triggers that may occur in the home life, through your work experience, at the office, sometimes with relationships and just personal changes as well. And certainly bariatric surgery qualifies as having a personal change. So bariatric surgery in itself does bring about its own form of stress. It's something that we all have to adjust to when we go through this. It's something that has to be a change in eating habits, a change in values, and so forth. And that kind of brings me to this point here as far as why is it important that we're even talking about stress management regarding surgery? What's the significance of this particular topic? And as I was just saying, there are many potentially stressful adjustments that you're going to have to make. So if you use old, unhealthy ways of dealing with your problems, or you have limited coping skills, and let's say you were someone who uses food automatically as a stress eater to deal with some of your conditions, some of your problems, developing new eating habits and developing a new lifestyle really around the bariatric requirements can be relatively challenging. And as a result, and as we'll see in more detail in just a moment, stress can have limitations on your weight loss efforts, physiologically as well as psychologically. So in so saying, if you are a stress eater, or if you are not better managing your stress going through this process, you might be more vulnerable to weight plateaus. You might be more vulnerable even to weight regain. And so that's why it's important you learn ways to understand how your stress impacts you in ways that you may have used old unhealthy coping mechanisms, and why it's important for you to develop new, better ways of appreciating how to think, how to approach weight loss, how to approach your general life, still stressful circumstances, so you don't give yourself a greater chance of having weight regain. So some of the things that the surgery can bring about, there is some tension generating internal reactions to weight loss surgery. So sometimes when people lose weight through the procedure, there are increased feelings of vulnerability. And so if you're someone who struggles with more low self-esteem, kind of concerns about your ability to be successful, you may question yourself with the weight loss. Am I worth this? Is this something that I can perpetuate? Can I keep this success going? So the weight loss sometimes exposes your feelings of inability to be successful with goals. Some of the other stressors that occur from having the surgery, sometimes there are changes in your personal values and in your self-focus. So you may have been somebody who, before surgery, if you struggled with weight for quite some time, you may not have been as clear about what your personal values were. Socially, there may have been some pressures to try to fit in. There may have been some fears about being judged or criticized. And so as a result, maybe you isolated yourself a little bit more. So once you lose this weight, now all of a sudden there are people that are noticing your weight loss. There's more of a feeling of accountability at times to other people. Sometimes you realize that the ways that you lived your life prior to the weight loss aren't how you want to continue to live your life. You want to develop different values. You want to promote different elements about who you are and how you live. And sometimes the changes of that can be stressful depending on what you've been used to. Other internal reactions to the surgery might be some issues pertaining to your new appearance. Sometimes people struggle with accepting the new person that they see staring back at them in the mirror. They're not always quite so clear about, is this person going to be staying? If you regain your weight, it might go back to an old familiar self-image. Sometimes there are some more realistic things like loose skin. Quick weight loss might promote that, and some people have a hard time adjusting to that. And as a result, they struggle with some stress issues. And if you're not clear on how to manage your stress, you might turn to some old unhealthy coping mechanisms, including eating. Sometimes there are also fears of weight regain based on the past dietary cycle. And what the dietary cycle is if you've been on a number of diets, you're pretty familiar with the idea of restricting your eating. Maybe you plateau at a certain point, and then there's a reactive overeating. You're only able to sustain the restriction that the diet encourages for so long until you start to have old familiar triggers come back, or to have some cravings kick in, or you plateau with your weight loss and you feel frustrated and maybe you just give up on the diet. So you go back to some old eating habits, you reactively overeat, and as a result, you might perpetuate the cycle of feeling out of control. So sometimes going through the surgery, there is a fear of regaining weight based on this. If you've been conditioned to lose weight to a certain point, level off, and then you usually put weight back on and maybe even regain more than when you started. That's the dietary cycle. And if you're conditioned to doing that a number of times, sometimes there's a fear that going through the surgery, that cycle can also occur again. The difference being that your stomach is going to be made smaller. There is going to be a different kind of physical restriction, which helps to discourage the automatic of weight regain. So unless it's something that you're mentally conditioned to want to try to keep pushing yourself towards, the restriction is something that helps encourage a healthier lifestyle versus a dieting mentality. There's also stress to just adjusting to new routines. And this sometimes comes about if you're someone who's never really planned your meals out consistently, or if you found yourself not grocery shopping effectively, organizing your meals throughout the week, and you just sort of eat on the run. Sometimes adjusting to the new structure and the new routines makes it more challenging, and sometimes more stress comes about. So as again, if you're not prepared for how to deal with those kinds of stressors differently, sometimes it leaves you feeling a little bit more vulnerable. Now, there's also some tension generating external reactions to weight loss surgery. So this is another reason why stress management is going to be relatively key in being successful with the weight loss in the long run, because sometimes there's those pressures that come from the outside. Sometimes with losing weight, if you've conducted yourself a certain way prior to this, maybe you felt that you were deserving of certain kinds of friends, maybe you didn't feel confident or comfortable enough making different kinds of connections, maybe healthier connections with other people. So sometimes when you lose weight, you start to see yourself in a different light. As a result, there might be a little bit more feeling of empowerment and a little bit more of a desire to change some friendships that previously may not have been as healthy for you. And along those lines, sometimes there's some potential changes in your marital or some of your intimate relationships. You know, the interactions with people that you felt most close to, sometimes those shift. Now, if you're someone that has had goals where you're on the same page, you have common interests, sometimes that helps the circumstances. But I often find that when one person has a different set of goals than the other person in the relationship, it makes things more stressful and more difficult to adjust. You know, some of the things that maybe can be helpful is trying to find common goals, things that both of you find beneficial from you having the procedure that allows you to kind of both grow together rather than in separate directions. There's also sometimes some stress that arises with conflicted emotions regarding reactions from other people. There are plenty of people that have the procedure, they lose weight, they feel self-conscious that with losing weight, now other people are noticing them. If there's someone that's felt more comfortable being on the fringe or being out of the spotlight, sometimes weight loss elicits more questions. And if you feel you are being questioned too much, or you feel you're getting too much attention from other people, that could be intimidating. It can make you want to go back to the sides, make sure you try to make you want to isolate a little bit more. So the stress that comes from how do you handle interactions from other people, new attention from other people, whether it's positive or even negative, even the judgments or criticisms that you might encounter from weight loss. Sometimes there's this idea that you losing weight and eating differently threatens what what they want to do. If it's someone that you've gone to restaurants with, that you've shared meals with, that takes comfort in you eating in a similar way that they do, you changing your eating habits sometimes makes it difficult for them to be accepting. So with that, there's different ways to break down understanding stress and understanding stress management and how it impacts obesity. And I want to approach this from some different ways, physiologically as well as psychologically. And let's start off with the physiology of stress and how it does impact weight loss, as well as weight gain and obesity in general. So in particular, the first thing to understand, there is a hormone called cortisol. Now, what cortisol is, it's a hormone that controls blood sugar levels, and it encourages the body to control fat. So when we experience high degrees of stress, our cortisol levels tend to increase. And what that does is it helps to regulate blood sugar, but it also helps the body to temporarily shut down, in essence, non-essential functions. So there may be a major stress in front of you that weight loss at that time isn't the most crucial thing that your body focuses on. So increased cortisol levels helps your body to basically shut down non-essential functions so you can deal with the problems at hand. So some of the symptoms of elevated cortisol can be rapid weight gain, high blood pressure. Some people experience muscle weakness. They might experience some mood swings, decreased cognitive functioning, and sometimes poor sleep or just some insomnia. And this is what I was saying earlier as far as how do we recognize stress? Well, some of those are the result of increased elevated levels of cortisol. There have been some studies done that have shown that for people with a history of weight stigma or obesity bias, there is a higher stress overall and higher long-term cortisol levels. So there may have been a buildup of cortisol levels throughout the years based on the amount of stress that you've experienced as a result of weight stigma. So as a result, because of that, it can create a vicious cycle of weight gain and weight retention. So it may be something that's already been in the works for quite some time, that the cortisol levels are high enough as it is, which makes weight loss even harder. And that may be why some people experience harder times losing weight once they engage in the weight loss surgery process. You know, there will be times where you hit a plateau where you may not be losing as quickly as you'd like. And because of past stress or even current stress that you're experiencing, your cortisol levels might make that very difficult for you to be able to continue along your progress. Now, I was mentioning just a moment ago about sleep, that insomnia might be a result of higher levels of cortisol. There have been numerous studies, one in particular from the University of Chicago in 1994, found a link between sleep deprivation and increased appetite. So if you've ever been in a situation where you've been tired, but you felt hungry, the study certainly applies to maybe what you've been experienced. So the study involved measuring participants over the course of 2 nights where they received about 4 hours of sleep per night. And because of the decreased sleep, what the study found was that there was a 28% increase in the hormone ghrelin. Now, ghrelin is a hormone that triggers appetite and hunger, and you may be familiar with the term ghrelin based on the weight loss surgery seminar, which talks about how with the procedure, there is a reduction in ghrelin, meaning that your appetite won't be nearly as strong. Now, even though there's going to be a reduced amount of ghrelin based on the weight loss surgery, decreased sleep can actually increase the production of it, as seen by the study. So there might be times where you are feeling more hungry, have a greater appetite than what you're used to, even post-operatively. Along the lines with an increase in ghrelin, there was also found to be an 18% decrease in the production of the hormone leptin. Now, what leptin is a hormone that signals the brain to stop eating when you're feeling full. So if you ever got to that point where you just feel like I've had enough, I'm good, I'm comfortable, usually it's leptin that is signaling the brain to say, no more food, we're doing okay. So with an 18% decrease, that means that it's going to be harder for your body and your brain to recognize when you're actually full. So with the increase in ghrelin, which means you'll have more of an appetite, and a decrease in leptin, which means you'll have more of a difficulty stopping eating once you've already maybe full, it's important that you get good sleep. Now, there's some additional findings with the study. Overall, they found that there was a 24% increase in appetite, and especially with a preference for high carbohydrate foods. So if you find that when you're tired, you're craving more rice and breads and pastas and grains, part of it is because of the decrease in sleep helps to contribute to some of these temptations. And one of the things to really keep in mind is over the past 20 years, US adults have decreased their average sleep time by roughly 2 hours of sleep per night, which means that we are more susceptible to these kinds of appetite fluctuations than maybe we were prior to 20 years ago. So going through this and helping you to manage your stress better, getting good sleep is going to be a very crucial and important way to try to manage. Now, you may be asking, how do you decrease your cortisol levels, in that it is a hormone? Well, this is a way of saying, how do you manage your stress? How do you keep things as in control as you possibly can? So there are about 7 ways or so to decrease your cortisol levels. So Probably the best way and the most prevalent is to exercise. And what exercise does is it helps facilitate the transport of cortisol through the bloodstream, where it eventually gets flushed out through the kidneys. And something as simple as just 18 minutes of walking every day, 3 days a week, has been shown to reduce cortisol levels by roughly 15%. So just even if you're someone that doesn't like to go to the gym, or you kind of are intimidated by the idea of having to do hardcore, heavier exercise, just 18 minutes of walking 3 days a week can sometimes reduce your cortisol levels. It's a good start. Some other ways to decrease cortisol levels to improve your overall stress management: eat your meals more slowly. So when we're under stress, oftentimes we tend to eat larger quantities. And I know there are some people that don't really eat very much when they are stressed, but for those that do, sometimes being stressed, it makes us feel more distracted. And like I was saying with the previous study, sometimes hormones they contribute to you feeling that you have a greater appetite than you normally would, or more difficulty stopping your eating. So try to eat your meals slowly, pay attention to your appetite, using measurements that are usually more common, that you know you're full when you've only had certain numbers of bites or a certain portion size, helps to kind of measure a little bit more effectively what your portion, what your appetite really is. So controlling your stress can be done just by slowing down, paying attention. There's also, with eating meals slowly, it allows for us to be more present-minded. And we'll talk about this in more detail as we go along. But by being under stress, it usually means we're more distracted. And because we're more distracted, we're not as likely to be thinking about what we're doing in the present moment, meaning we may not be paying attention to what we're eating, or if we're stress eaters, we might be going for more hard carb foods, more comfort foods. So slowing down gives us an opportunity to think about our choices, what the food is actually doing for us, and so forth. So trying to eat slower helps you to be more present, and being more present has been shown to actually improve meal planning and food choice and appetite control. Now, this third one would apply more for someone who was not pursuing the surgery, but stopping strict dieting. So constant dieting tends to increase cortisol levels by roughly 18%. It's because of the stress of the expectations that come with dieting. So the other part of it is that when we try to diet, we're restricting certain kinds of nutrients. Sometimes there's an increase in cortisol, which equals a blood sugar spike, which then has sharp declines. This can lead you to feeling ravenous, and as a result, relatively cranky. You know, those mood swings that we were talking about earlier. So when the brain is deprived of the proper sugars, either through dieting, overly restricting, we can actually be producing some altered emotional states. This can result and lead to diminished willpower, poor meal planning, maybe giving up on diets or dieting methods a lot faster. Now, I said earlier that this is something that really applies more to people that have a history of just only dieting, maybe not pursuing the surgery. But that mindset might carry over to after the surgery takes place. So if you have this kind of mindset of having to be on a diet, I would really try to encourage you, don't strict diet, but as the surgery and the lifestyle would encourage, you have a healthier lifestyle, that you eat according to what we would ask and what the nutritional guidelines are, but that it doesn't have to be to the point of what a more traditional dieting method would encourage. So there's a little bit more of an acceptance of what you're doing. And also the size of your stomach and your appetite allows you to feel that you're not really sacrificing as much as you might would with a diet. The fourth method of trying to reduce cortisol is to give into cravings, but just a little bit. So you might be someone who realizes that even if you have, let's say, a bite of chocolate, that could be a slippery slope. That could be something where you eat way too much and you have a hard time controlling it. So maybe giving into those cravings for you may not be the right thing. But giving into cravings just a little bit, what it does for other folks, maybe it allows you to be able to move on and to focus on better meal planning. You know, if all you're doing is thinking about the food that you can't have, the craving that keeps calling to you, sometimes having a bite, recognizing the taste, being satisfied by that, just even just a little, allows you to move on. And it's not an indulgence, it's just being able to kind of satisfy just that moment. There's something I've talked about this in other talks where it's called prize envy, that the thing that you want the most, if you're deprived of it, you tend to have increased desire for it. So to withhold something from yourself actually triggers you to want it more and to think about it more. So by giving it to cravings, even just a little bit, it allows you to feel that you've satisfied yourself and you can move on. The fifth method here is try to avoid caffeine when possible. So studies have shown that stress and caffeine does tend to raise your cortisol levels roughly 25% more than just being under stress alone. And this is for someone who might drink roughly 2 to 3 cups of coffee a day. So if you're under a lot of stress, a lot of pressure with work, for example, you're drinking a lot of coffee, you're actually setting yourself up to be have higher cortisol levels, and as a result, maybe interfering with your appetite and your meal planning. The sixth method, try to power up at breakfast. I know a lot of people get very busy with their day and sometimes they skip breakfast. One of the things that we do try to encourage with the weight loss surgery and with the lifestyle is that you plan your meals on a more regular basis. Eat more frequent small meals throughout the day. So if you are skipping breakfast, you might be setting yourself up for more stress management challenges. So it's been shown that deficiencies in vitamins such as B, C, calcium, and magnesium, they tend to be stressful for the body, and they can actually contribute to you feeling more anxious. So that's where it sort of builds on itself. If you're feeling more anxious based on nutrient deficiencies, and that leads to greater stress management difficulties, meaning that you have a difficult time solving problems, it's a vicious cycle therein. And the last way that you can try to reduce your cortisol levels is, as we were saying earlier with that study, is to get more sleep. By getting more sleep, you're helping to regulate your hormone release of ghrelin and leptin a lot easier. And you also might not feel as irritable, which means you'll be able to be more present, more confident in your ability to solve problems and stay on task. So the physiology of stress tends to have an underlay as far as why sometimes weight loss can be challenging. So it goes hand in hand with understanding the psychology of stress as well. And the psychology of stress is going to be some of the more obvious things that we may think about as far as our thought patterns, some of our ensuing behaviors, different ways that we try to actively manage our stress. So in going through this, I'm going to try to help you to understand maybe some of the thought processes behind stress management and ways to recognize those better, as well as to challenge them with some better ways of coping. So when we're under stress, we have a tendency to feel more self-doubt. We may feel a lack of direction, and we may question ourselves. We may question our self-worth. We may have lowered self-esteem. We may not know exactly how to best solve a problem. So managing stress and understanding it from a psychological purpose will help us to feel that we have a little bit more of a roadmap in going forward. So if you are someone that is more susceptible to stress, higher levels of stress might lead to you giving up in light of adversity or in light of challenges. And we talk about something in another group topic called fixed mindset. And this is just the belief that nothing you do is going to make a difference. The higher the stress might actually encourage you to be more rigid and to be more afraid of trying to take on new challenges. There's a fear of making mistakes, fear of doing the wrong thing, but it leaves you feeling relatively immobilized. So if you're someone who gives up in the light of adversity or challenges, this can have real serious impact with you being successful with the weight loss in the long run. If you give up on your goals, if you don't try to keep your efforts going towards better weight loss, obviously weight regain or stagnation can be the result. So what we try to do is encourage you to be more, what we say, growth mindset oriented. Believe in your effort. Don't look at your mistakes as mistakes, but rather find the opportunities to do better, to do differently. Find different ways to solve the problem, which would also help to reduce some of the stress you may be experiencing. So as the next point says here, by reducing your stress levels, we do have a way of feeling more in control. We remain psychologically more resilient. It also allows us to have a more realistic sense of our problem-solving tools. There isn't that question mark of, well, I don't know what to do. If you're calmer and you're not as stressed, you know exactly what to do. And even if you don't, you might know who to ask to get help. And that's why having the team at the Kane Center is so important. You may not have all the answers, but medically, you would turn to your surgeon. Nutritionally, you would turn to the dietitian. Psychologically, you can always come talk to me. So even if you don't have a realistic appraisal of your problem-solving tools, one of those tools may be knowing how to take advantage of your resources. There's also a more proactive sense of accomplishment, and you might believe in yourself in meeting your goals, should you be able to do that. We also need to understand psychologically our thinking styles. So particular thoughts have impact on how we conduct our behaviors. So if we understand how our thinking styles might lead to more stress or more difficulty solving problems, it can help us to challenge those differently and to come up with more positive solutions. So there are some ways to identify your thoughts, and it may say something about your emotional state, depending on what kinds of things you might say to yourself. So some of the cognitive identifiers that you want to be conscientious of. Sometimes we have more of an anxious style. Sometimes there's more of a depressive style of thinking when we are under a lot of stress and a lot of pressure. So the anxious style is going to be something along the lines of an open-ended question, almost like a call out to the universe that doesn't really have a particular answer. So if you're someone that is saying something to the effect of, how much more of this can I take? Or when will this all end? You're asking a question with really a specific answer to it without any particular guideline. And as a result, that tends to promote more anxiety, more worry about when this is going to be over. So if you're asking those kinds of questions, you might be more susceptible to anxiety, or you might already be feeling a lot of anxiety. And it's important to understand with your stress to challenge that kind of anxious way of thinking. So for example, if it is an open-ended question, how much more can I take, or when will this all end? Maybe a way of closing the loop on that to reduce the anxiety and reduce the stress would just be to make it more specific. It's not so much how much more can I take. I can handle what I can handle for today. Limit the scope. When will this all end? Answer it by saying, I don't know. But all I know is that today I have a plan, and I know I can plan a meal, I can plan for exercise, I can plan for other coping skills. So that is all I need to worry about is the present moment. And all of a sudden that existential kind of anxiety sort of goes away because you're just managing what you can actually manage in the moment. And we're going to get into more detail on that in a little bit. Now, the other style that you may have is more of a depressive style. So if you're asking questions such as, why me? Or nothing I seem to do really works, it points to you feeling inadequate. It points to you feeling ineffective in trying to solve your problems. And there's more of a self-blame that goes on. So if your depressive style is that, it's important you understand that, because nothing I do works. Well, nothing is what we call a terminal language. There isn't a lot of option to solve a problem if nothing works. But maybe the question needs to be, I don't know if the things I've tried to this point have worked, but maybe there's another solution I'm not aware of. How do I go about finding what that solution might be? And that is certainly just a way to try to challenge some of that depressive style, so you don't feel, helpless or powerless in your efforts. There may be days after the surgery that you question if you're doing things the right way. You may be not losing the weight that you want to. You might get anxious, or you might get depressed about it. And you might ask these kinds of questions. So it's important in those moments that you don't let those thoughts take over, that you find ways to challenge them and to find alternate ways of asking those questions that gives you solutions. Now, in understanding the psychological approach to stress and to understanding maybe a way that people try to make sense of things that sometimes don't always make sense. Sometimes with stressful circumstances, we aren't always clear about why something is happening. We might be, as I was saying a moment ago, nervous or depressed about those things. So there is a theory of thought called attribution theory. And let's explain this a little bit, just so you have a sense about how you might understand putting causality to maybe some of your stressors, or to make sense of things that otherwise wouldn't make a lot of sense. All right, so what attributions are? They're inferences that people tend to make to better understand their circumstances and their environments, and their experiences. So there are two main types. Typically, we have internal attributions, or we have external attributions. So internal assigns causality to factors within yourself. So things that you've done, things that you did, things that you will do is what explains the behavior. If you can think back to grammar school or high school, maybe you didn't study for a test and you failed the test. The internal attribution would say, you know you didn't pass the test because you didn't study. That's on you. The external attribution assigns causality to factors in the environment and outside of your control. So using that last example, if you failed a test in high school, someone with an external attribution would blame the teacher, would say that there was something on the test that wasn't taught in the class, that the teacher has it in for them. There'd be all sorts of other reasons. The room might have been too cold. There's all sorts of reasons why it wasn't their fault. And that's some way that they can blame and maintain a sense of confidence, or not to feel depressed about what they did wrong. So with the procedure, we obviously want you to have more of an internal attribution. We don't want you blaming external causes for why maybe your weight loss isn't going well. All that does is just serve to promote more stress. So stress will persist if there are too many external attributions. What it means essentially is that if you don't take responsibility for your own choices and look to yourself for how you're going to get back on track, you might be busy looking for blame for causality. In so doing, your stress is going to be higher because you may not find the reasons why, and there may not be anything you can really do about the external attributions. If you go outside and it's raining and you don't bring your umbrella and you get wet, it's kind of hard to blame the sky because you got wet. The internal attribution would be it's my own fault, or I didn't use my tools, so let me go get an umbrella and do better next time. There might be some efforts to try to give up on your weight loss if you are feeling helpless, because if you do give too much credit to the external factors, you are more likely to feel helpless and powerless, as I was saying a moment ago. What we find is that when we make more internal attributions, when we take more accountability, more responsibility, we also change our attitudes about our potential. We don't dwell on the things that went wrong. We don't look for other reasons why things didn't work out in our favor. Once you take responsibility, even for mistakes, it's easier to move on. It's easier to use your mental energy and your resources towards more productive things. You're not busy trying to cover up the mistake. So we do change our attitude about our potential, and that is certainly important as you're trying to achieve a goal with weight loss. Now, there are some other ways cognitively, psychologically, that it's important that we understand how we think, so we have better ways of being able to improve our stress management. And those things are called cognitive distortions. Now, what these are, we all use them. We all use them to varying degrees. You can see there's a whole list of them here, and we'll go over some of these. But what they are, they're patterns, they're styles of thinking, but they tend to limit our problem solving, and they tend to increase our stress. They reduce our stress, limit our stress reducing efforts. These styles and these patterns of thinking, they tend to make sense to us. We get it, but at the same time, it doesn't really make logical sense when you stop and look at it more carefully. Now, these cognitive distortions are something that we probably used for quite many years. They can be just automatic. We may not even recognize that we're using them. So it's going to be important, if you do use any of these, that you try to catch them the best you can. You try to slow yourself down and be as aware of them as you possibly can, so you can try to change your thought patterns for just better goal setting and stress management. Now, some of the ones I want to go over, let's just start at the top. All or nothing thinking. Now, what this is, all or nothing thinking is sometimes called black and white thinking. If I'm not perfect, then I failed. There's only one way or the other. There's no middle ground. These are things, either you do something completely right or you do it completely wrong. Now, if you set a goal for yourself with the weight loss of a certain, let's say you want to lose 100 pounds. Let's say you hit 80 pounds as a weight loss. The all or nothing thinking might lead you to think that you failed because you didn't reach that 100 goal mark. And because of the difference with stress, the gap between where you think you should have been and where you really are, 100 pounds versus 80 pounds, you might experience more stress. So it's important that you find some shades of gray in between the black and white. And that shade of gray could be an appreciation for what 80 pounds, for example, has done for you, how it's helped your health, how it's reduced maybe your medications, how it's improved some of your diagnoses, your comorbidities. So those are sometimes the important things. It's important that we look at those things that we call them non-scale victories, to be able to appreciate how well we've done, even if the scale maybe hasn't moved or that it seems to be stuck. Trying to find ways to challenge that all or nothing can help you to keep moving forward. The next one there is overgeneralizing. And this is seeing a pattern based upon a single event. And you make an assumption that because of that single event, that's the way that it's always going to be. That the conclusions for every event thereafter will be the same as that first one. So a lot of times people experience this with dieting. So if you've been on one diet or you've been on 10 diets and you find that you have the same result, you might begin to anticipate that no matter what you do, the diet is going to end up the same way. Doesn't matter what your effort is. That's overgeneralizing. So sometimes as people go through this procedure and they start to think, you know what, I'm going to start this and I have a feeling this isn't going to go very well. I'm probably going to regain all the weight in the end anyways. Based on past dieting experience, there's that dietary mindset. It might cause you to overgeneralize your results and not make the right efforts in trying to be successful after your bariatric procedure. Now, the next cognitive distortion here is mental filter. And this is only paying attention to certain types of evidence. You might be someone that just wants to notice your failures without seeing any of the successes. So if you think about a drop of ink in a glass of water, how it discolors the entire glass, that's a mental filter. It's difficult or it's risky for you to want to see positive things because what if they're not lasting? What if you want to believe in the positive things, but you're worried that it's not meaningful, or you're worried that it won't be a permanent change? So sometimes it feels safer to focus on just the negative thing because it's something that we prepare ourselves for. We as people tend to have greater memories for negative than we do for positive. So as a result, if you're hyper-focused on just a negative event or something that isn't going well, it might be a protective device, but it might be worth your effort to try to see some more positive things as well and learn to accept those. Now, along those lines becomes disqualifying the positive. This has an element of mental filter to it. And what disqualifying the positive is, as a cognitive distortion, it's discounting the good things that have happened or that you've done for some reason or another, maybe insisting that they don't count. And I find that this happens quite a bit where people have a hard time accepting compliments. So if somebody says to you that you look great or that you're doing terrific with your weight loss, and you find a way to dismiss it, you find a way to find an excuse to say why they're wrong or why they're not looking at the whole picture. So for example, somebody says, wow, you've lost weight, you look terrific. And you say, you know what? I don't really look terrific. I've only lost a little bit so far. I've got a long way to go. That's in essence disqualifying the positive. Now, why are people doing that? People disqualify the positive because they have a fear that by accepting a compliment, it means that they're jumping into the unknown. They're familiar with the negative comments. They're familiar with the negative self-appraisals. Yes, it's unhealthy, but it may feel safer. So to agree to a compliment means that you're venturing into a territory where you've not really used to seeing yourself thrive. You're not used to trusting your abilities. You're not used to trusting that what other people see about you is lasting. So you might want to try to dismiss it as a way to feel safe, but maybe the thing to try to do is learn to accept compliments, learn to find the truth in them that you can agree to. It's a lot easier to accept a compliment when there's something specific and measurable versus more of a general. So if somebody says you look great, great can be debatable. But if they say you look like you put in a lot of effort to try to lose weight, or your shirt looks like it's too big on you, that's measurable. And that might be something that you can agree to. It makes it a little bit easier to move through the acceptance of the compliment. Now, jumping to conclusions, there's two main types of these, um, mind reading and fortune telling. So jumping to conclusions, in essence, through mind reading is imagining that we know what others are thinking about us without bothering to check it out. There's a lot of insecurities. I was talking earlier about the stress that comes about from getting the reactions from other people. With mind reading, if you've lost weight, or even if you're someone who struggles to lose weight, maybe encountering somebody new, you have an assumption that they're judging you or that they're being critical in some way. That's mind reading. That's a thought that because of past experiences, other people must be thinking the same thing. We want to be careful that we're not projecting those things onto those people. Maybe the insecurities are our own. Maybe there has been a history of being judged, but that doesn't mean necessarily going forward that those same judgments may be there. So it might be important to try to check out those assumptions and get more of a realistic sense about what someone else might be thinking or how they might be reacting to either your weight loss or maybe your weight loss struggles. Now, the other one regarding jumping to conclusions is fortune telling. And this isn't so much a mind reading kind of element, but this is more of a prediction, predicting the future. And we do this because we feel vulnerable in the moment sometimes. We're not always confident about how things might work out. We might be worried that we won't lose weight. We might be worried that we're going to regain it. We might be worried about a whole host of things. But by fortune telling, by predicting how things will turn out, it makes it feel a little bit safer. So if you've ever been to a scary movie and you try to guess the ending, or you try to guess when the villain is going to jump out, that's fortune telling because it helps us to feel more secure. We're not going to be caught off guard. We're not going to feel vulnerable. So if you find yourself fortune telling, do your best to try not to predict the future, but be as accepting of the present as you possibly can. The next one is trying not to magnify. So magnification or catastrophizing and also minimization. This is just blowing things out of proportion. If something isn't going well, it's not to the end of the world or the worst thing that's ever happened. It's just try to keep it in perspective. It makes it feel less overwhelming to try to continue on your path to solve a problem. But if you blow it out of proportion, it feels too big. You may give up quickly. Emotional reasoning. This is a style of thinking that assuming that because you feel something to be a certain way, that's for sure how it is. So it's based on a gut reaction. It's based on your thoughts, not necessarily your thoughts, it's based on your emotions, your feelings about how something is going to turn out. So the example they give here is, I feel embarrassed, so therefore I must be an idiot. And that's not necessarily true. That's just going to be your fear. That's just going to be something that you have to pay attention to the emotion. Challenge it with something that shows that there's not necessarily a truth to that emotion being that thought or that fear of judgment that might come about. Should statements are going to be pretty important also as far as going through the procedure here. We've all used the word should. I should exercise. I should eat differently. Or I shouldn't have eaten that. You may have moments after the surgery with your weight loss where you make a mistake, where you've eaten something that wasn't on the dietary plan, or you missed a day of exercise, and you might criticize yourself for it. Sometimes we say things like should because it feels like it's reassuring that we're doing the right thing or that we're thinking in the right way. Oh, I should have gone to the gym. In other words, at least I knew that I was needing to go to the gym. But what a should statement actually does, it is a way of you reinforcing a sense of failure. I should have done that means that you didn't do that. I shouldn't have eaten that means that you did eat that. But it also promotes a feeling of helplessness, that there isn't really much that you've done to try to, there's not much that you can do to make things better. So if you're using a lot of should statements or must or ought tos, what you might be doing is reinforcing a sense of powerlessness or helplessness. Oh, I shouldn't have done that, meaning that the event has already passed and you didn't do it. Therefore, there's a criticism that you can put on yourself. What you want to do in this case is try to make a should statement an active voice. So for example, I didn't go to the gym. Don't beat yourself up over it. If you make it an active voice, that becomes, I didn't go to the gym. Take responsibility for the lapse, own it. Once you own it, you're not trying to avoid it. You're not trying to protect yourself. You're trying to solve a problem. So I feel guilty for not having gone to the gym. All right, I feel guilty. I didn't go to the gym. Now you can create a plan because you've already owned it. You create a baseline to jump forward from. You're not trying to avoid. So I should have gone to the gym. I'm going to go to the gym. I still have time in my day. I'm going to schedule this and I'm going to do what I said I was going to do. And then there's also labeling. If you put a lot of self-blame on on yourself, if you call yourself bad at weight loss, for example, based on past experiences, you're not giving yourself any options to be able to try to move forward. And the same goes for personalizing. Oftentimes people with weight issues do personalize, that they blame themselves. And that's, we talk about that in another study altogether, another discussion talk, where if you make things too much your fault, it's easier for you to give up on your effort. But if you find realistic reasons why maybe weight problems exist, social pressures, genetic issues, factors like that, it allows you to feel that you can have a plan going forward, that because you're not blaming yourself as much, that you can take responsibility for what you want and you can move on. Now, along the lines of cognitive distortions, something else to pay attention to psychologically in helping to manage your stress is going to be a concept we call self-talk. Now, what self-talk is, it's a monologue, it's an internal voice. It's a way that we talk to ourselves that promotes stress, and it can perpetuate those cognitive distortions that we just discussed. So there are two main types of self-talk that you want to be considerate of here. There's negative self-talk, and there's also positive self-talk. So with these mental scripts, these ways that we kind of rehearse and talk about some of our concerns, they often appear in more telegraphic form. And what this means is there might just be a word that we say to ourselves, or there might be a thought, a small thought, or something that comes to mind. Within there is it contains a whole series of thoughts, a whole series of memories or associations. And that's where that idea of labeling almost comes in. If you're self-critical and you call yourself a name for doing poorly with weight loss, there's a whole history of maybe unsuccessful weight loss attempts tied up into that one particular word. So we aren't always aware of all of those memories and all those associations, but it's encapsulated by that one telegraphic word that still has the same effect to have a rise in our stress and limiting our abilities to feel we can solve our problems. And the thing that's really key here is that anxious or your negative self-talk, typically this is irrational, but it sounds like the truth. So that emotional reasoning, cognitive distortion that we talked about a moment ago, if you have anxious self-talk, it may be that you feel something is true, but that might be more irrational. It may not be based on anything, but it certainly sounds like it's truthful. So that's where it's important that you recognize that this internal monologue actually might perpetuate your stress. It might make you feel having more challenges in losing weight or achieving the goals that you set out for yourself. And if you have too much negative self-talk, sometimes it perpetuates feelings of avoidance. You may, in other words, convince yourself not to even try because you have all these worries about, yet again, something being unsuccessful. So it's just easier to avoid trying in the first place. You get away from that growth mindset to put in effort. And you can see by the cartoon here, be careful how you are talking to yourself because you are listening. And we do pay attention to what we tell ourselves because it helps us to feel safe, but sometimes it doesn't always have our best interest at heart. Sometimes we need to take certain calculated risks and trust that we can use our resources, use skills that we may already have to be successful. So there are 4 types of self-talk, of negative self-talk, really. So these kind of fit different personality styles, and you're going to want to understand what maybe your personality style may be if you do fall into the categories of some of this self-talk, because in so doing, remember I was saying earlier, anxious styles of questions or depressive styles of questions can actually perpetuate more stress or feelings of inability to solve a problem. By understanding maybe what type of negative self-talk you engage in, you have a different plan to challenge and to come up with more positive self-talk, more of the belief in yourself, the ability to try to take on challenges differently, not to feel threatened by them. And the first one here is called the worrier. And if you're someone who would label yourself as the worrier, the worrier voice tends to promote anxiety. Now, the worrier imagines the worst case scenario, how things are going to be horribly wrong no matter what. There's that overgeneralizing or the catastrophizing thinking. So they imagine the worst case scenario, fantasies of disaster when you imagine confronting your fear. Let's say you do want to take on your fear. You may come up with dozens of consequences for doing that, which just limits you in wanting to go forward. You may give up and walk away because it just feels easier than trying to have all these awful things happen. So the worrier will help you to believe these things. And the worrier has a particular expression that they like to use. It's called what if. So if you find yourself asking the question, what if often with the surgery, what if I regain my weight? What if I plateau? What if I don't lose as much as I want? That voice is the worrier. So it's going to be important that you look at the worrier in a different kind of way. And instead of what if, those are things that haven't happened. Those are things that you can't necessarily do anything about. Again, the thought challenge needs to be, what is it that I can do right now? What's in my control? What solutions do I have at my disposal? The next type of negative self-talk here is the critic. Now, the critic promotes low self-esteem. And if you have a critical voice, you're constantly judging and evaluating your behavior. You're pointing out your flaws and your limitations. You're putting yourself down. And the favorite expression of the critic is, well, that was stupid. In other words, you don't give yourself any credit for things that you've done well. You don't give yourself, yeah, I didn't reach the goal that I set, but at least I did these things right on my way to reaching that goal. You need to find ways that you can not judge your behavior as much as give yourself credit for efforts that you've made. If you're pointing out your flaws and your limitations, try to find things that were, hey, I've never done that before. Of course, I'm not going to do it as well as someone who's done it a number of times. I tried exercising. I only went 10 minutes. The critic would say, well, that's terrible. But the way to challenge the critic is say, at least I got on the treadmill. At least I tried. And tomorrow I can see how much better I do. So with the critical voice and your feeling of low self-esteem, try to find the non-scale victories. Try to find the small things that are even believable and measurable that you think went positively. And that could help to actually undo that kind of thinking. Now, there are other types of negative self-talk. There's two others. The next one is the victim. And if you have the victim as part of your negative self-talk, that's the voice that promotes depression. And this is the part of you that feels maybe hopeless or helpless, that why me, or, what have I done wrong? And if you're someone who feels that way, you're obviously going to feel very limited in how you approach a problem, how you solve a problem. And your stress as a result will feel more intense because you don't feel you have the right tools necessary to achieve the goal that you have in mind. The victim mentality convinces you that there is something inherently wrong with you. And as a result, the belief is that nothing will ever change. So as you set a goal for yourself in being successful with weight loss surgery, but the victim tells you, who are you to think that you can do this well? You're not going to. You might believe it. You might give up. The favorite expression here is, I can't. So if you're someone who feels you can't, that might be more of a sign of depression, but it also might be the mental script that you have that says that you're a victim, that you can't necessarily be successful because inherently you're flawed. That's why it's important to have better self-esteem, better self-worth. Try to find small victories that you can trust, that you can believe in, that promote a better sense of accomplishment. You don't necessarily have to believe that you can achieve everything based on some of those smaller victories, but you do have to agree that those victories were done by you. And maybe if you have enough smaller victories, you can build on those and create even bigger ones and challenge and undo the victim mentality. So in other words, don't try to lose 50 pounds. Try to lose 1 pound 50 times. And the smaller successes you have along the way, maybe eventually you get to the place where you feel you're doing better and you don't need to believe that nothing will ever change because you're actually seeing some changes and you can believe that. Now, the last type of negative self-talk here is the perfectionist. This is the voice that promotes chronic stress and burnout. It's a close cousin of the critic, but it doesn't want to put you down. What it wants to do is actually push you harder and further, that your efforts are never good enough. Yeah, good job in doing that, but you could do more. What you did wasn't enough. You got to keep going and keep trying. Otherwise, it's going to slide away from you. So your self-worth is, in essence, it's dependent on these external factors. It's dependent on how well you can do and how hard you can push yourself. And what I was saying before, the cognitive distortion of should statements, this is the favorite expression of the perfectionist. So you keep pushing yourself. I should be doing better. Hey, you lost 75 pounds. Good for you. Yeah, but I should be losing more. Oh, you went to the gym today. That's great. Yeah, but I should be going every day. You're not giving yourself enough credit for the things that you're doing well already. You need those kinds of things to feel good, to feel successful. And so if you're saying I should or I have to, you constantly feel you keep pushing yourself. Those perfectionistic tendencies will never allow you to accept your successes with weight loss or your success overall with the bariatric lifestyle. You need to be able to appreciate some of the things that you've done. You need to be able to appreciate that there's a victory in what you've done to this point. And sometimes feeling that things are good enough, or even if there's more of a reasonable goal to keep striving for, that's okay. But unrealistically pushing yourself towards great is a sign that you may be burning out. So how is it that we can find ways to combat our stress? How can we do better to manage our expectations and to combat some of those cognitive distortions that we had talked about before? And I think this quote from Viktor Frankl, who's a psychologist, what he says here, I think sums that up. Between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. In essence, what he's saying is that we don't just have to have unrealistic expectations or be questioning about what kind of tools we have to reach our goals. We don't have to just feel that frustration if we don't feel capable, but we can make choices. We can do things to be able to manage that space differently, to change our expectations, to develop different kinds of tools, and we can grow from that. So part of stress management with the bariatric surgery is just that. It's making sure you have the right tools necessary. And hopefully with some of the tools that the ways we talked about with cognitive distortions and attribution theories, there's a way to see maybe how you're perpetuating stressful moments in a different light. And it gives you a little bit more empowerment to be able to feel that you can manage your meal planning, your food choices, and your adjustment to the bariatric lifestyle better. And one of the things that we want to consider is what's called distress tolerance. So in the idea of feeling that we're overwhelmed, we have a lot of stress going on, distress tolerance, as by its definition, is the ability to endure emotional discomfort without turning to harmful coping methods. So if you're a stress eater, you'll be turning to food as a way to deal with emotional discomfort. All that does is necessarily mask the emotional pain and the emotional discomfort that you may be feeling. And we want you to find alternate ways of managing stressful situations, because there will be stress after your surgery regardless. Stressors don't necessarily go away, but your ability to manage them differently and to tackle them in a different way will be helpful. So you need to be able to experience some stress without trying to over-control it. So if you're trying to dismiss stress or over-control it or deny that it's having an impact on you, sometimes over-controlling can lead to just mental exhaustion. And as a result, you may lead to some stress eating. It might lead to just poor meal choices, and it might just cause you to question yourself, which leads to some self-esteem issues. So you want to be able to accept stress through distress tolerance, because what it does is it allows you to be able to give yourself the confidence that you can handle what's in front of you. You can manage it. You will find a solution, and it'll give you better focus and just an improved use of coping skills. They'll give you the ability to define and to build coping skills that can manage your problem, because you're not running away from your stressor, but you're taking it head on in a different kind of way. Now, there's two concepts here to consider with distress tolerance and how to achieve it. The first one being mindfulness. And what mindfulness is, it's a mental state achieved by focusing your awareness on just the present moment. So all you need to do is just calmly acknowledge and accept your sensations as they are without emotionality. It's about feeling if you're sitting in a chair, it's a sensation of how your feet feel on the floor. It's like what sounds you hear, it's what you see, and not putting any kind of value to it other than just feeling it for the sake of feeling it. And mindfulness is a skill that you can practice anytime. So if you're feeling stressed or overwhelmed, all you need to do is just do something that takes your mind off of the worry, takes your mind off of the fear that you won't be able to achieve some certain goals. And you can do something as simple as clenching your fist, and you can feel how your fingers feel tightened up. You can wiggle your toes inside your shoes. You're just acknowledging how your feet feel. That's all it is. And it takes your mind off of the stress of what the future may be worrying you. So it is a skill that you can practice anytime. And I would encourage you during the times of eating, just focus on the sensation of eating. So for example, if you're someone that's a stress eater, you might not even be paying attention to what food tastes like. You may not be acknowledging, how much you're eating or how fast you're eating. Try when you take a bite to acknowledge the just various flavors that might be in that bite. Before you chew it up and swallow it, just what does it taste like? What's the temperature? What's the texture of it? And it just brings your focus back to the present. That's all it's meant to do. And, you might find that you have a better control over your appetite as a result. You might be slowing yourself down and recognizing when you're actually full. So mindfulness could be a really good way to help with stress management, as well as managing your stress eating or your eating habits even better. And so mindfulness can be used as a way to achieve better radical acceptance, which is the second concept here. So what radical acceptance is, it's a skill that it builds on the skill of mindfulness. And it allows you the ability to observe a situation without any judgment, to be more objective about it. And in turn allows for better distress tolerance. So radical acceptance is that you can experience stress and you can be more objective about it, not so self-critical, not so upset that it's happening, but you can just recognize that it is happening, that it isn't anything that you need to do other than just pay attention to it. And you can feel that you can get through the moment better. So while mindfulness is the path, radical acceptance is the destination. So by being more aware of your sensations, being more aware of your behaviors, maybe thoughts that you have, the radical acceptance of it means that you are able to just be more objective without any kind of feeling overwhelmed. Now, what are some ways to practice radical acceptance skills in your daily life? One is just acknowledge the reality of your circumstances. When we try to deny ourselves stress, or if we're in a situation with weight loss that we're frustrated and we're not losing what we want, the reality is we're not losing what we want. We're not, making the food choices that we thought we would make necessarily. So just acknowledge the reality of what you're in, and it just allows you to feel a little bit more centered. The second one here, the past is in the past. Don't dwell on mistakes. In fact, use those as opportunities to be able to learn from them, to grow from them, to develop just more of a resiliency. Yes, things happen. Yes, choices you made may not have been your best option, but what'd you take from it and how do you do better for next time? Number 3 is develop some coping mantras. Just some things that you're going to say to yourself. Things are, I can do this. Positive self-talk, in other words. Things that just remind you that you'll be okay. This is just for the present moment. This is only for now. This is something I'll get through. I can learn from this. Whatever it is that you might want to come up with that just helps you to cope a little bit easier and gives you more of a positive disposition. Number 4 is you're only human. In other words, you're going to make some mistakes, and that's okay. It's just about not beating yourself up for those mistakes. And as we were saying before, learning from them and accepting that these things are part of the growth process. Let go of your judgments. In the truest form of radical acceptance, you want to make sure that you're not being judgmental. Judgments cause you to want to give up. They might be too painful to bear, and you might let go of some of your meal planning or your eating habits. Your healthy eating habits that might get you towards your goals. So try not to be judgmental. Try to be forgiving of yourself. And that's what number 6 is all about. Have some self-compassion. If you make a mistake, again, learn from it. Be forgiving. Things happen. You are still in the learning phase. It takes your mind and your experience with what you've been doing all along It takes time to undo those things and to learn new ways of coping. Accept responsibility. This goes back to the attributions. Don't blame external factors. Take responsibility, find the internal attribution. What can you take responsibility for to allow yourself to move forward? And that's what it's all about, is learning and moving on, growing in the process. And number 9, challenges that black and white concept that we saw with the all or nothing thinking of the cognitive distortions. Try to see the gray areas. If you're too focused on one goal, certain amount of weight that you were hoping you were going to lose, or a certain meal plan that you're destined to follow, but you deviated, you snacked a little bit, try to see the gray. So for example, let's say you made a bad food choice. Maybe you stopped yourself from eating it after 2 bites. Give yourself credit that you didn't go to 3 bites. Do something along the lines of that has a little bit more forgiveness to it, and it'll help you to manage some of the stress a little bit easier. And then finally, in terms of stress management, there are some familiar techniques that do help with just kind of lowering your blood pressure, making you feel a little bit more at peace. Relaxation breathing is certainly one of them, and that could be 4x4 breathing, things as simple as breathing in for a count of 4, holding for a count of 4, exhaling for a count of 4, and then pausing for a count of 4. And you do that repeatedly. The relaxation breathing is one of the more fundamental things that you can do to help bring a sense of more calmness to you, manage stress. Meditation is another good technique. Sometimes just starting your day off with some simple meditative techniques allows you to go through your day without feeling overwhelmed. Grounding techniques are some of what we were talking about with seeing the gray areas, allowing yourself to experience sensations with mindfulness. So when we take a bite of food, sometimes the grounding techniques are just to kind of pay attention again to the flavors, pay attention to the textures. Grounding is anything that takes your mind away from thinking too far ahead and too far into the future and brings it right back to the present moment where you have more control. Visualization techniques, this could be anything as far as imagining a peaceful place that you visited, picturing a simple image like a cloud or a balloon floating or a candle flame flickering. Just something that, again, simplifies your thoughts and takes away the noise of maybe some of your worries. So visualization could be a good way to lower some of your stress. Positive affirmations. This is simply just saying some positive things about yourself, things that you'll believe, things that are provable, and giving yourself encouragement. This is the positive self-talk that does challenge some of the negative self-talk that we were talking about before. You know, if there's a criticism that you have of yourself, try to find something that counters that. Try to find 2 things that counter that. And just practice saying those things on a daily basis. And eventually the idea is that you'll start to truly trust those ideas. You can turn to just healthy hobbies or interests, things that take your mind, jigsaw puzzles, anything that could be considered a distraction from just daily worry. I always think it's a good idea to take time for yourself first. You know, oftentimes the analogy I like to use is if you've ever flown in your oxygen mask, they tell you in the speech, if the oxygen mask drops down, they never tell you to take care of everybody else first. They always say, put your own mask on before you take care of others. And part of it is that you have to be good for yourself so you can be available to take care of other people. So schedule time for yourself. If you feel your day is busy, what window of time can you give yourself that you're going to be at least able to say, this is only for me? And part of that's going to be about your ability to maintain clear boundaries. You know, if you're doing too much for other people, you're going to feel exhausted, you're going to feel stressed out, and you're going to feel pretty depleted pretty quickly, and you're going to give up on goals. So maintain some clear boundaries. Make sure you're clear about what your goals are. Make sure you're clear about your communication with other people about what you need. And just more practically speaking, if there's certain foods for you that are tough to stay away from in times of stress, just try to keep them out of the house or try to keep them at a distance best you can. By doing that, it's one less thing it's in your way. You want to create as many obstacles to attaining those foods as possible. The harder they are to get to, the less likely is you're going to indulge, and the easier it is that you're going to be able to walk away and find some better way to deal with your stress. So hopefully with the talk today, I know there was quite a bit about stress management, but hopefully you can see how it applies with bariatrics, with achieving your goals for the long run. for being able to manage conditions relating to stress eating, or just even to help you with furthering your weight loss a little bit easier. But try to find some ways, and hopefully there's a few techniques you can walk away from this talk with. I hope it was helpful for you. Thank you very much for being here, and best of luck with the procedure.